Hello everyone, welcome to sqadia.com. Today the topic of our lecture is bulimia nervosa. Now this is a kind of an eating disorder which is characterized by a binging episode which is followed on by a purging episode. So binging is basically characterized by consuming large amounts of food in a very short period of time. And after this episode, the person basically suffers from a purging episode. Purging is basically a strong desire to get rid of that food. Now, how do they basically get rid of that food? By placing enemas or by vomiting it out. So this is basically characterized by the purging episode. So we'll be discussing this interesting eating disorder over here in this section. First of all, we'll be discussing the psychopathology that is underlying this kind of the psychiatric condition. The risk factors that are involved over here, we'll be discussing them briefly, but obviously the risk factors include the environmental factors. Also, the personal traits are again very important over here. So obviously, the complete history taking will reveal the psychopathology of that particular case that we're dealing with, whether it was the environmental conditions, whether it was the socioeconomic status or the cultural pressures that basically debilitated the person into this kind of a psychopathology. And then the history is again very important. To every psychopathology, there is a history. How was it discovered? Who was the first one who discovered this kind of a psychopathology? We'll be discussing them over here in the first section. In the second section, we'll be discussing the clinical manifestations or the symptomatology that is related to bulimia nervosa. Now, the signs and symptoms will be discussed briefly over here. When the patient walks into your clinic, how are you going to diagnose he's suffering from bulimia nervosa? There is ICD-10 criteria, which basically gives you a diagnosis, the baseline for the diagnosis of bulimia nervosa. Then we'll be moving on to the binge eating phenomena. As I've already mentioned, there are two episodes basically. There is a binge eating and then there is the purging phenomena. So we'll be diagnosing how are you going to highlight that the two episodes have been there, and that is how I have diagnosed this particular person with bulimia nervosa. The psychiatric comorbidities usually coexist with this kind of an eating disorder over here. In the third section, we'll be discussing the psychological diagnosis. The DSM criteria for the diagnosis is very crucial over here. Then you have to differentiate this kind of an eating disorder with some organic disorders even present in the same manner. People usually consume a lot of food in short periods of time, and that can be due to some other organic pathology. So you have to differentiate and you have to have your differentials at your hand. Then you have to differentiate this eating disorder with another common eating disorder known as anorexia nervosa that we've already discussed in another lecture. But the differential features of anorexia nervosa and bulimia nervosa will be summarized over here in this third section. Then we'll be moving on to the bulimia treatment plan. So we have to manage these particular cases in a particular way. The psychotherapies are usually conjugated with the pharmacotherapies. There are particular drugs that are usually given depending upon the type of comorbidities that are existing. For example, if a patient is suffering from depression, the antidepressants are conjugated with the treatment line of bulimia nervosa, and then the psychotherapies or the counseling sessions are also inculcated in the management plan. So that is how basically you help that person to bring him back to life. The pharmacotherapies will be discussed over here, and then we'll be discussing the prognosis of the patient also. So it can be a good prognosis. It can range from a very excellent prognosis to the poor prognosis depending upon the comorbidities. So I hope you want to learn more about bulimia nervosa. So do watch the other sections of this lecture as well.